Thank you for attending the Pandemic Safety Protocols Update. This is in regards to contactless home visits for foster care and adoption. Through this deck, we'll walk you through all the best practices that you will need to follow in order to ensure that you and your families are safe during these visits. The first thing to understand is that your safety is critical to our success for contactless in-home health and safety assessments. So you want to ensure that you follow these best practices to make sure that you and your families are in the best possible position to be safe and sound during these times. Before you conduct your health and safety assessment, make sure that you take your temperature. The CDC is very clear that if you have a temperature that exceeds 100.4 Fahrenheit, that you should stay home. You should also immediately notify your supervisor. There's no exception to this rule. Due to current legislative mandates, our social workers are required to conduct home health and safety assessments, but we want you to understand that your safety is our number one priority. So in order to support that, we have crafted this contactless in-person consultation process that will help keep you as safe as possible as you carry out this important work during the current pandemic. Now, it's extremely important that zero physical contact should be made between you, the social worker, and your resource family during the consultation. You want to make sure that you maintain a safe bubble. So, adhering to social distancing guidelines and making sure that you protect yourself is extremely important. Now, first thing first, we need to set the proper expectation. So, to your resource family, you want to explain the reason for the home assessment to them. Next, you want to verify that the family is comfortable with our process to make sure that you're safe and your resource family is safe. And you want to make sure that the children are prepared. So perhaps a pre-video chat along with the resource parents to help discuss how to prepare the children for the contactless in-person safety assessment and explain the wearing of PPEs for health and safety. Next, you want to verify that the caregiver and other individuals in the home have their own face covering or mask and that they will be asked to wear it during the contactless in-person home consultation. We want to make sure that with those masks that they're covering their mouth, their nose, and their chin. If they indicate they do not have them, be sure to ask them to obtain them prior to the visit. And during your pre-call, you may want to just verify that they did acquire those masks before entering the home. And make sure to limit exposure to those essential to the process. So it's important to verify other individuals in the home and if they can wait outside of the home during the duration of the consultation. Ideally, only the prospective or approved resource parent and foster child or children should be in the home to participate in the contactless consultation safety assessment. Let's talk about the items that should be in your safety kit. In your safety kit, you should have an N95 or KN95 mask. It's recommended by the CDC to use these masks because they're more effective against the Omicron variant in comparison to a cloth mask. You should have hand sanitizer, a forehead thermometer, and extra pins to leave with your clients. We also suggest that you may take disposable gloves, a face shield, disinfectant spray, and paper towels, along with a trash bag to dispose of all your PPE gear. If you don't have any of these items, please reach out to your manager so you can get set up. Now, if you and your client feel comfortable and you choose to proceed into the home, I want you to keep this in mind. Be sure to maintain social distancing rules of 6 feet. Refrain from touching any surface areas in the home. Keep your visit to the observation of the physical environment of the home. All other discussions can take place outside of the home. The intake should be done outside the home as long as confidentiality and safety can be maintained. At any time, should you be concerned that there has been exposure in the home, end the assessment visit and report this to your supervisor immediately. Any documentation that cannot have an electronic signature should be done with a leave behind pen and papers left with the family. You should then take a photo of the paperwork for your records. So you don't need to get the pen back. You don't need to get the paperwork. You only need to take a photograph of the signed paperwork for your records. Ending the visit safely. When you reach your car, pop the trunk and properly dispose of gloves, masks, shoe coverings, and outerwear gear into your garbage bag that is stored in your trunk. So, to make sure that you have all your gear and all your safety supplies with you, just store them in your trunk. It's an easy way for you to access them, and plus, it ensures that none of that material or any type of virus is transmitted into the interior of your car. You want to thoroughly sanitize your hands with the hand sanitizer that you have, making sure that it's at least 60% grade alcohol, and additionally, wipe your phone down completely with disinfectant wipes. Now, using your disinfectant wipes or your disinfectant spray with paper towels, you want to make sure that you wipe down the outside of your trunk, your keys, the entry to your vehicle or the door handle. If it's safe, make sure that your purse, you just leave it stored in your trunk during your visit to limit any type of virus transference. If not, make sure you wipe down your purse or your shoulder bag thoroughly before putting it into the cabin of your vehicle. And finally, once inside the cabin, wipe the steering wheel down, seat belt latch, and gears if you came into contact with them.
Now, should you be assigned to a client site for work, please make sure that you fully adhere to the client safety protocols and guidelines, as well as Children's Bureau guidelines. If there's any type of conflict between those two guidelines, just reach out to your supervisor for clarification.
Thank you for attending the contactless in-home visit training. In order to receive credit for this training, on the next slide, you will have to sign an acknowledgement by simply stating yes. If you have any questions, please reach out to your supervisor for any further clarification.